Hi, everyone. Welcome to our 2020 Virtual Advocacy Day. For the first time ever, Resolve and the American Society for Reproductive Medicine will host a Virtual Advocacy Day on May 20th. We are so excited that you will be joining us in this first ever event, and we have a great day planned for you. The purpose of today's webinar is to help you understand what you're going to be talking about on May 20th. And joining me, this is Barb Coulor with Resolve. Joining me today is Becca O'Connor. Becca is with the Government Affairs Office of the American Society for Reproductive Medicine. She works in their DC office. She's an experienced advocate and lobbyist and healthcare public affairs professional. Becca, thank you so much for being with us today.
Thank you for having me, and I'm excited to join all of you in this event.
We're looking forward, Becca, for your first advocacy day with our team, too. So looking forward to having a great day. Let's go ahead and move to the next slide. So what we're going to cover today are the bills and the issues that you're going to be advocating for on May 20th. We'll give you a little bit of background on those pieces of legislation. We'll talk a little bit about how you share your story and advocate. We're also going to share with you some tips for making this day very effective for us and our issues. And just remember, we're talking about May 20th. That is coming up in a few weeks for our virtual advocacy day. Next slide, please. Go ahead, Becca.
Great, thank you. Sorry, I was unmuting myself. I want to start by giving you a little bit of a lay of the land for what to expect on Advocacy Day. You will have 3 scheduled virtual meetings. So every state has 2 senators assigned to it and 1 member of the House of Representatives. And our goal is to make sure that you're heard with all of the members that are pertinent to your state. So clearly, it's a lot to juggle, but our goal is to bring you before them virtually and to remind you in these conversations, which we'll talk more about as the planning continues, your voice is key. Your voice puts a real human story behind some of the issues that can otherwise just seem like another thing in the list of topics that they're considering. And so this is a really vital opportunity to be before them and to share why you as a constituent need them to pay attention to these issues.
Thank you. So let's walk through the issues that we'll be advocating for on May 20th. The first one is the Access to Infertility Treatment and Care Act. This is a bill that's been introduced in both the House and the Senate. If you came to Advocacy Day in 2019, we also advocated for this bill. Remember, Congress is on a 2-year session. So last year, 2019, was the first year of the 2-year session. 2020 is the second year. That means that any bill that was introduced last year that has not yet passed is still alive, is still an active piece of legislation. So we still have an opportunity to talk about it. This session of Congress will end in December of 2020. And so this is our chance to really advocate for this legislation and to get more support for our issues. The Access to Infertility Treatment and Care Act is a bill, we like to call it the big, if you think about a piece of pie, this is the big piece of the pie, this is the whole pie. This is a bill that actually covers insurance for fertility preservation if you've got cancer and also IVF. It states that infertility is a disease. It includes coverage for all of the plans that the federal government is responsible for. That would be things like the military and federal employees. And then it also has in it provisions to cover, include IVF and fertility preservation in the private sector as well. So this is a really fantastic bill because it gives us a chance to talk about our issues, to talk about issues about cost, about access to care, and the importance of having insurance coverage for our issues. The next issue that we're going to be talking about is also a bill that we've advocated for in the past. It's called the Women, Veterans, and Families Health Services Act. This is a bill that's also been introduced in the House and the Senate, and it requires the Veterans Administration to provide IVF to people who have a service-connected injury that has impacted their fertility. While we have been successful in getting IVF covered by the VA each year, that's through what's called the appropriations process, we really would prefer to have this be permanent, have the IVF provision for the VA permanent. That's what this bill will do. It also provides some other resources to wounded veterans on how they can build their families. So this is a very important bill, gives us an opportunity to talk about that issue with veterans. We'll have language and messaging for you in your meetings to share how this is being handled through this appropriations process, and actually why passing this particular bill would be far better. The third bill you're going to talk about is called the Every Child Deserves a Family Act. This is a bill that it sounds a little unusual in that we have had certain states that have passed laws allowing discrimination in how adoptions are handled in their particular state. Some of that is by agencies who have federal contracts to handle foster care adoptions in a particular state, and others that receive other kinds of state and federal funding. And it has allowed these agencies to discriminate. That might be discriminate against adoptive parents who are of a particular religion or faith, or maybe marital status, or even sexual orientation. And so this federal bill would supersede all of those state bills and actually says, you can't do that. You cannot discriminate when it comes to adoption, when it comes to determining who is and isn't a good potential adoptive parent. It also provides protections for adoptees in foster care and others as well. So this is a bill that we're part of a wide coalition of organizations advocating for this bill. And then another bill that's related to adoption is the Adoption Tax Credit Refundability Act. And this is a piece of legislation that would allow more people to access the adoption tax credit. It actually is aimed at more middle to lower income families. The only way right now that you can use the adoption tax credit is if you have a tax liability, if you're paying taxes, if you owe taxes. And a lot of people don't because of their income levels and such. And so they are shut out from being able to take advantage of the adoption tax credit. And so a refundable credit allows people to get money back from the federal government when they have outlaid certain expenses related to their adoption. So this would really open up a lot more people to being able to afford to do an adoption. We'll provide you with some of this information for your meetings, but interesting to note that there were a few years when the adoption tax credit was refundable, and they actually saw an increase in adoptions out of foster care and more people able to adopt. So there's, again, a very big coalition of organizations that are fighting for us to go back to that policy so that more people can adopt. And Becca, you want to do the last couple here?
Absolutely. So the next thing that we're going to ask you to talk about is PCOS Awareness Month, and specifically a resolution that is an annual measure that Congress takes up. As you likely know, PCOS is polycystic ovarian syndrome, a very serious genetic hormone and metabolic and reproductive disorder that affects many women and girls. And it's also, pertinently, one of the most common but treatable causes of infertility. So without going too far into the weeds, it's important to just know that the month of September is annually dedicated to raising awareness about this syndrome and about efforts to raise funds or continue funding for research and the like. And we're asking you to make sure that that is on the radar of the members, because what will happen is at some point a letter will circulate, and I'm sure more details will be forthcoming in your packets, but asking folks to sign on to this resolution. And it's an easy ask, frankly, for us to make, and a great way for them to signal their support just by signing on to the resolution. And then finally, medical research funding. It's another topic that we ask, I'm sure, every single year. It's huge for its impact and a small lift in terms of the ask. The National Institutes of Health is the home of so much of the work that we see on the federal level to ensure that we are performing research and supporting programs that will help families such as yours in the fight against infertility. And we are at the critical stage in the game, which comes up annually, where lawmakers are making critical decisions about funding for the National Institutes of Health and other agencies in the annual federal budget. And the way that they make those decisions depends largely upon from whom they hear. So hearing from you that the NIH and continued and adequate funding for its institutes and its research is key, because it gives them, in a sense, permission to prioritize it when they're making their asks to appropriators, or the people making those spending decisions. And so in addition to a broader ask in relation to the National Institutes of Health and continued funding for them, we also call out and ask you to give a little shout out to the National Institute for Children and Families, NICHD. It plays a critical role in advancing research on these issues. They have programs that are specifically tied to issues like maternal mortality and PCOS, and we just ask that you also give a nod to them when you're talking to your members about why it's important that they not only address the issues that arise on the back end, but also put significant resources into researching the causes and treatments that will ultimately lead to better outcomes for families.
Excellent. Thank you, Becca. Next slide, please. All right, Becca, you've been a lobbyist and done a lot of work on Capitol Hill. Tell us what to do.
Okay, first things first, have fun. I know it can be overwhelming and intimidating to be joining some of these meetings, especially if you're a first timer. But as someone that has sat on the other side of this table, I was a staffer up on Beacon Hill in Boston for several years. I can assure you that your voice matters. It really does. So recognize a couple things. One, as the slide says, this exercise is not one and done. In other words, we are squeaky wheels in advocacy. And so please know that every single touch that you're making here in terms of the meetings, the tweets, whatever follow-ups you're asked to do by Resolve and others, they matter. And the compilation of contact is what ultimately can move the needle. Importantly, and I think we've already touched on this, your stories matter in the sense that they put a real human story behind something that can otherwise be murky or something new to a staffer or member of Congress that perhaps hasn't experienced it. I remember well meetings where advocates would come in and share their personal story, and they're the ones that stand out to me, because when the senator would say to me, "Who did we hear from?" I could pull on those memories and think, gosh, Jane from Wisconsin said to me that this was really important to her, and point that out. I think the expect the unexpected bullet is critical. You absolutely should. It probably less so in the virtual context. Hopefully, we can hope. Although who knows, technology can be tricky. But in meetings, you may be asked to stop and restart, for instance, if somebody joins a little late. I've had meetings where the senator themselves walk into the room after I've already done my entire elevator pitch, and the staffers turn and say, "Why don't you repeat what you said?" And you can also rest assured that there will be meetings, and I don't know exactly who you'll meet with, but if you wind up face-to-face with somebody who looks a little, let's say, young, maybe, we joke and say somebody fresh out of college, but, bear in mind that they still are the person that member has chosen to represent their office. There are young staffers on the Hill. Treat them with the same respect and expect them to communicate your interests to the member. Don't be put off by that, because it doesn't mean that your meeting is any less important. It just means they're finding as many people as they can to cover the bases. Don't be overly partisan or argumentative. I think this hopefully speaks for itself, but at the end of the day, your job here is to educate. So while you should approach this with the understanding that, lawmakers need these discussions, they need these meetings, their staff need it, because they know a lot, but they don't know everything, and they certainly don't know about necessarily all of them, what the human impact is of all of this. You don't want to pick an argument and refute point by point what they're putting forward. There's plenty of time for that in follow-up, and we can help you strategically do it in a way that won't alienate a potential ally. But at the end of the day, they're there for you, and they want to hear from you. So don't pick a fight. Be sure to say thank you. Their time is valuable, of course, as is yours, and it goes a long way to say thank you. And to take notes of anything that you hear them asking. Well, how many times does this come up in my jurisdiction? You may not know the answers, but keeping track of that sort of thing can be helpful, because then particularly if they raise a concern, where we need to do a little more work, and we as a collectively, and we can debrief on all of this, and we can educate them or follow up with additional data that might help sway their perspective. And then finally, follow up. Absolutely. That goes back to, this is not one and done. Don't expect to walk away and not talk to this office again. Remember that they are, especially the reps, they are local to you. And so be prepared to follow up. And I know Resolve will make sure that you have the tools to do that.
Thank you so much. I am hearing, Becca, that, while our scheduling of these meetings will be with staffers, you mentioned the staffers, I'm hearing that a lot of these virtual advocacy days are getting a lot of the members of Congress as well on the call. So we just don't know who exactly it'll be. We may not know till that day. And you said expect the unexpected. You may have a scheduled meeting with a staffer, and you've got the name of that person, and then that person gets on and says, well, guess what? My boss is going to be able to join the call. You're a member of the House of Representatives. So boy, that could be an exciting time, but also expect the unexpected.
And roll with it, because just one note on that, they're people too. They have bigger titles sometimes, but these are people that really do need to hear from you. So don't let that sway you from being passionate.
Excellent. One of the most important messages that you'll be giving on Advocacy Day on May 20th is about infertility. It's about the disease of infertility. It's about the struggles that people go through to build their families. And it's about being pro-family. So one of the things that we're going to be helping you do over the next few weeks before May 20th is learning how to share your story. If you are a professional and you are not someone who's personally lived through an infertility journey, you have a story to tell as well. There will be people in your delegation who might be the point person on sharing their story to different legislators on particular issues. And it's so important that they get that personal connection with you. This is why you are doing this. Becca and I can go to Capitol Hill every day of the week, but we will never be able to make the impact and the progress that you will make on May 20th. One, because you're a constituent, and number two, because you're going to be walking in there with your personal connection and your story. You're going to look for ways to connect your legislator with our issues. I don't think there's anybody on Capitol Hill who would say they're not pro-family. So we love to use that phrase, and over the next few weeks, just keep saying that over and over in your mind. Pro-family. I'm pro-family. You're pro-family. We all are pro-family. And I think most of the meetings will probably have somebody who has gone through this infertility journey or maybe is on their journey right now. They will be encouraged to tell their story. And again, we'll help you over the next few weeks learn how to do that in a really effective way so that you feel really comfortable and that the person you're talking to, that staffer or that member of Congress, really gets to understand what you've gone through and how the issues that we're advocating for would have made a big difference in your life had they been in place. And then, again, emphasizing family. We are about building families. These issues are pro-family. If there's one thing we want to leave in the minds of that staffer or that member of Congress when they hang up the phone is for them to say, wow, those are the family people. Those are the people that care about families. This is about as, apple pie that you can get. And we shouldn't really, in a perfect world, have anybody who's against this. But we do know that words matter, and you are there to deliver a specific message and get them to learn and be educated about our issues. So I hope that thinking about these terms and these words over the next few weeks makes it just flow right off your tongue when you're in those meetings on May 20th. Next slide, please. Well, that's it. We want to thank you for participating and coming to our virtual advocacy day. You don't really actually need to go anywhere, but signing up and participating is going to be so impactful. We are getting record numbers of people registering from a record number of states, so we could have the biggest impact we've ever had, quite honestly, on Capitol Hill. If you have any questions, email us, advocacyday@resolve.org. It couldn't be any easier. Any questions that you have at all, we need to hear from you. We are so looking forward to training you and working with you over the next few weeks, and then, of course, having you advocate on May 20th. Becca, I want to thank you for participating and for all the help and support from ASRM on this big day that we have coming up.
It's our absolute pleasure and our honor, honestly, to help elevate your voices. So keep those questions coming so we can be sure to address them and make this as seamless as possible for all of you, because we need you.
Thank you so much, everyone.